everybody. I appreciate your time for joining us today. My name is Eddie Chavez Calderon. I am the campaign organizer for Uriel Aesthetic in collaboration today with Arizona Juice for Justice. Super happy to bring on another event for everybody that enriches, educates, and activates our community towards social justice and activism. Today, we are super excited to have Dr. Amish Shah, who will be joining us very shortly. We're having a little bit of tech issues right now, but he's going to be joining us very shortly, who I am happy to know and work with and collaborate with on our activism work and how do we promote more community engagement. We're going to go ahead and start us off with some Torah because we're going to be really contextualizing the similarities between our faith communities, really yawning for that enrichment and that community engagement, and also having those medical practices to best stay safe. So we're going to first start off with some great Torah from my great mentor, Rabbi Shmuly Yanklowitz, who's going to start us off with a quick Torah learning. We're then going to move on to Dr. Amish Shah, who's going to, it looks like he's here, who's going to be leading us in our conclusion here and talk to us a little bit more about what's going on currently with this pandemic. And I think he's here. Hi, Dr. Amish. Thank you so much for joining us. We appreciate you so much. I'm going to go ahead and start this off again with my great mentor, Rabbi Shmuly Yanklowitz, who's going to talk to us about some Torah, trying to collectively put everything together into like our faith. Why is this important? Why now? So, Rabbi, go ahead and take it away.
Thanks, Eddie, and thanks for pulling this together. And great to see everyone. Thank you for joining us. You know, we envisioned this program in response to the Haredi protests in Brooklyn, because we saw that some people might be confused about the Jewish position on such matters, because they saw that there were ultra-Orthodox Jews out in the street who were protesting against public health precautionary measures. And so we wanted to put out there a little bit of clarity as to what we understand as a Torah perspective, as a Jewish perspective, which intersects with our social justice mandates from our tradition as well, as to just on a basic level, how we think about these health issues in relationship to other human needs. And so I'm just going to share a few words of Torah, and then Dr. Amish Shah, our friend Dr. Shah, is going to share a little bit of a reminder of what many of us may have read and may have heard about precautions, and then we'll open it up for some questions and thoughts. So let me start, before I say a few of the halachic and moral mandates, something theological, which is I believe that the dominant thrust of Jewish thought, of course, there's many different eras and many different ideas that emerge in different time periods and different locations, but the dominant thrust widely can assume ein od milvado, right? That there's nothing but God in the world, which is to say, there's no duality of body and spirit. There's no duality of mind and matter. There's no binary of body and soul. I know we like to talk about the physical world and the spiritual world, but once we say ein od milvado, everything is HaKadosh Baruch Hu, everything is God, that means there is no, it's an illusion. There's monism, right? Everything is God. And that is to say, excuse me, to take care of the body is not some hedonistic, overly physically concerned, vain enterprise. Yes, there are vain enterprises associated with physicality, but to take care of one's physical self is, in a sense, to take care of God's image. When we talk about every human being created b'tselem Elokim, in the image of God, it's unclear what we're talking about. Are we talking about the body? Are we talking about free will? Are we talking about the capacity for reason? Are we talking about the human capability with speech? Right? There's a whole bunch of different ways that Jewish thinkers have thought about what makes humans in the image of God. And yet all of that is about the whole self. The whole individual self, not bracketed, the whole self is in the image of God, which is to say that to take care of one's life is a theological enterprise. It's the enterprise of preserving God's image in the world. Okay, so that's the first bit. The second bit, a concept that we've heard of many times, but is worth reminding us, is that pikuach nefesh, saving life, outweighs all mitzvot, with the exception of 3, right? That is to say, and those 3, as a reminder, are murder, idolatry, and a form of sexual immorality. So this is to say, if somebody says, Rabbi Shmuly, I want you to eat this pork or I'll kill you. My answer is, pass the barbecue sauce. Give me some barbecue sauce. I'd love to have it. You know, that's easy one. If they say, kill this person or I'll kill you, right? Then I have to say, I'm sorry, you'll have to kill me because I can't kill to save my own life, right? And so by and large, we say, v'chai behem. V'chai behem in the Torah means mitzvot are about life. They're about life. It's about the value of life, right? We live through the mitzvot. We don't die on behalf of them. Yes, tragically, there have been Jewish martyrs who have had to die for being Jews, but the mitzvot are about the affirmation of life, the sanctity of life, and about living through them, rather than saying we're going to ignore public health protocol because we have other religious mandates we want to presume. Now, it's interesting also, if you look at Devarim 4:15, Deuteronomy 4:15, the only time the word me'od is used in the Torah in a halachic sense, me'od means like a lot or very, is v'nishmartem me'od l'nafshotechem, right? You should guard your health. That is the only time in a legalistic sense the Torah uses the emphatic word me'od, right? It says, okay, these other stuff, you should do it all, but here you really got to pay attention, right? Take care of yourself. Take care of yourself and take care of each other. Now, it's interesting because many of us work like Dr. Shah or other public health or medical professionals here on the call, where we didn't have the mitzvah of pikuach nefesh. How many of us had the chance to save lives? It's very hard to save a life, right? If you're not a medical professional. Okay, you donate some money, you hope you're saving a life, right? You wait for some moment, you're gonna push the guy out of the way of the car, right? Maybe you do the Heimlich in a moment in a restaurant, someone's choking, you get this rare moment to save a life. And now all of a sudden, right? There are these easy ways for us to save lives, right? There are these ways that we understand that we may be responsible for killing or saving literally thousands of lives based upon our own personal responsibility. So I could talk all day about this issue of public health and the intersection of health and of body and of Torah. But I felt that we needed to respond to these protests, which said we really need to be in the yeshiva right now. We really need to be in the shul in mass right now. We reject the government's limitations on our wedding sizes. To say this is, I would never say it's not Torah, because I think Torah has many faces, but I think this is not authentic Torah. I think this is not authentic Torah, which is very clear that public health has a major responsibility in. And I think it's a chilul Hashem. I think it's a chilul Hashem, a desecration of God's name, to suggest that we should reject governmental and medical protocol in favor of some abstract religious mandates. So with that, I want to pause. I'm available for the Q&A also, so that we can learn from Dr. Shah. Eddie?
Thank you so much, Rabbi Shmuly. Yeah, and now we're going to go ahead and transition to Dr. Amish. But first, I want to give you all a little bit of a bio of Dr. Amish before we go forth. Not only is he our personal friend who we're happy to have in support, but Amish was born and raised in Chicago with his mother and father, who were engineering students who immigrated from India in the 1960s. His father is Jain and his mother is Hindu, and he attended a Catholic school from K through 12. He attended Northwestern University in Evanston and graduated cum laude in the Bachelor of Arts in Economics. He graduated from Northwestern University in the medical school as part of the honors program in medical education. Everybody, I'd love to introduce to you my friend Amish, Dr. Amish Shah, who's here to educate us. Dr. Amish, give us an update. How are we doing? Are we spiking? What is going on in this pandemic right now?
First, I just want to say thank you, Eddie. You guys are absolutely wonderful. The work you guys do, and just following you guys is a real joy. And Rabbi, thank you for the words. Very enlightening. I certainly learned something from everything you're talking about, and I'm sort of glad to hear it. Those of you on the call don't know, I've known of Rabbi for a longer time than I've known Rabbi. We actually had a friend in common way back when he was in New York City and I was in New York City, and we actually had a chance to have a real nice lunch, also with Eddie. Like I think it was like a year ago, was it not?
Yeah.
Yeah. So we've had a real chance to connect, and I've just heard so many amazing things about how you guys as an organization do your work, but also Rabbi Shmuly, like your own personal work and how much you've done to advance the causes of justice in your lifetime, and it's truly pretty inspiring. So if those that don't know, like, all his background and everything he's done before this, it's pretty remarkable stuff. We're very lucky to be on a call with somebody like him. So I want to say, with regard to the public health issues that we're bringing up, that we're in a place right now where we are seeing again in Arizona, as well as really all the rest of the country, that the cases once again are spiking. We had a huge spike in the summer, and at its peak there were about 5,000 cases per day in Arizona. The death rate from those cases was lower than we have seen in other parts of the country. I think part of the reason for that is the demographics. We noticed that younger people were getting this, and of course, as we know, age is one of those probably one of the biggest risk factors. The older you get, it seems to exponentially increase the death rate. Whereas what happened in Arizona, we had a little lead time from New York City, and we learned some lessons from that, specifically that the more elderly segments of our population should be kept segregated in order to keep them as safe as possible. And so putting some of that into practice, I mean, some of it was done through actual state government policy. Some of it was done independently, voluntarily. People themselves knew, hey, we're not, we're at risk. We know we're at risk. We're not going out, and that helped keep people safe. So we had that spike. Things kind of, went down, and there are several reasons for that. But some of it is the natural course of it. You're going to have a peak, and it'll go down as all those people that are out and about tend to get it. And of course, our public health measures all come in. They brought the curve down, and now we're seeing a little bit of a spike again. Across the country, we've set new records in the last week with the number of coronavirus cases. Some of that is Arizona. A lot of it isn't Arizona, though, because it is some of the places that had never really gotten hit all that well. And so now we're seeing more of that. Some people have argued that, and school started, and so we're starting to see people mix a little bit more. We're also perhaps witnessing some fatigue from people that said, I've had enough, and then they're being a little more lax than they used to be earlier on. So there are various causes that we think is pushing this forward. And then when you look at the death rate in this spike that we've seen, it is less than we have seen. So in the summer, if you looked at how many people were dying per day, it was higher than it is now. And again, that might be because of who gets it, where they get it, and then also the fact that we have made some advances with regard to the treatment of it. We know that certain things work. Remdesivir is a drug that we've been giving. Convalescent plasma is a drug we've been giving. There is dexamethasone, which is shown to work in the moderate to severe folks. I mean, all these things are given to folks that are moderate to severe, rather than all those mild cases. So, and then we've discovered, believe it or not, flipping people back and forth over like a fish, proning them and making them supine while they're on a ventilator seems to do some real good. So these are the kinds of things that have been happening, and that might those things also might drop the death rate, even if the same number of people were being intubated. So that's kind of a broad 25,000 foot view of what's going on. I think that we also have to continue to ask ourselves, like Rabbi Shmuly mentioned, what can we do to help save lives? And again, it comes down to just making your personal contribution. The best thing you can do, wearing a mask is really, really important, because masks are not perfect. We know that. Masks, however, do, in the studies that have been done and the evidence that we do have, significantly do reduce the rate of transmission. And so you could have it, not know that you have it, and just by being out and about in your community with your family and friends, give it to grandma who's next to you at the grocery store, and cause a really bad outcome. So it is not definitive and perfect, but when applied across an entire community, certainly makes a big difference. I have a feeling I have too many people on this call that disagree with me on any of this. I'm throwing it out there, but I also want you to spread that to everybody in your networks. And I think that's important. I think Rabbi Shmuly brings up this idea that there are certain groups and certain populations that have been a little more resistant to that, and perhaps for some other reasons, perhaps based in religious interpretation. And I certainly get the fact that we're a very pluralistic society, and even within one particular religion, you can be very pluralistic. I get that. I don't know if Rabbi Shmuly, I think I mentioned that I did, it was about a year ago that I went to Israel, and we spent about 2 weeks there as part of the Arizona Israeli trade delegation. We opened up a trade office there. And of course, you spend a little bit of time and understand. We met several famous politicians. We were invited to the foreign ministry to sit and ask questions of high-ranking government officials. And truly, it was a remarkable experience. What they did for us and how they treated us as their guests was amazing. Besides, of course, doing all the touristy things that you would do and being out late in Tel Aviv, right? But you get the fact that actually Israel itself is also dealing with some of the challenges that you mentioned, and then they're sort of working through that. So I appreciate everything you're saying, and I hope that people take what you're saying to heart, because it is crucial. It's people's lives that are at stake, and we're on the cusp. Also, what makes this particularly poignant today is the fact that we are on the cusp of a vaccine. So if you saw this morning, the news that Pfizer released their data on the preliminary data on the phase 3 trial, which, by the way, I am a part of. I volunteered for that trial. And they said that 90% of the people who got it were in the placebo arm, which is absolutely wonderful, meaning that the vaccine is really efficacious. Not only, that's the big thing we needed to know. We already got the sense that it was very, very safe, because in 40,000 people in the phase 3 trial, and then all the people in the phase 1 and 2 trials before that, we have not seen any serious adverse results. And then to get a result saying 90% of people are safe, they're preventing these COVID infections, is just going to be multiply that across society, and you're talking about a lot of life saved. A lot of people. You're talking about hundreds of thousands, if not millions of people saved from this virus, saved from death. And so we're just now on the cusp of it. And Pfizer, the way this is going to work, Pfizer is going to ask for an emergency authorization based on their data. They'll have it reviewed. There'll be some peer review first. There's some steps that scientists always do. And then they're going to go to the FDA. They're going to ask for it. They've already been working before this thing was even ready. They're going to be working on they've been working on the distribution. So we know we have distribution networks and arrangements already being made. So we're so close to just getting everybody a vaccine and putting an end to this. And what a shame it would be to lose people's lives right when we're nearing the finish line and almost have the answer. And I hope that also sinks into people's heads. What a travesty to lose somebody when the answer, when the vaccine is about to come in about a month or 2 or 3. And then that's what I want to leave you with. I want to leave you with some message of hope that we're going to get through this. We are almost at the finish line. Let's not give up right before we're about to take care of this once and for all. So with that, I want to open it up if anybody has any questions or
Thank you.
comments or arguments.
Yeah, arguments. Yeah, we're gonna deny science right now, and everybody's gonna go after you.
Got it.
Okay, so we have a couple of questions that were brought upon beforehand, and as well as I encourage folks to write on the chat your questions here. Again, the presentation initially was till that half-hour mark. You are welcome to stay for the discussion to continue. We hope folks can stay on. But the first question is for Rabbi Shmuly. And this is a question, what do you say to the faith communities who are like, listen, we need to be together to be able to worship, to be able to feel God, to be able to be united. Those folks who are like, you know what, I need to be with my friends and family for Shabbos dinner. Well, what do you tell folks? And I know that other people are getting ready for other holiday events, and our community just got off of high holidays. What do you tell the faith community, the Jewish community, the more Orthodox community who are saying, you know what, we're just gonna do what we want, and we're gonna hang out and we're gonna worship together? Oh, you're on mute, Rabbi. You're on mute.
Sorry about that. You think this many months on Zoom, I wouldn't forget such things. So great question. Just two things as a segue in. First, one thing that I hear among people of all groups, young people is, oh, doesn't affect me. You know, like I'm young, I'm safe, and we've heard this for so long. And this is like the most un-Jewish thing someone can say, right? That as if like seniors' lives don't matter, right? And first of all, it's wrong on the science level that they're okay, you know, being younger, that yes, there may be lower risk. But secondly, the idea that that transmitting to someone who is older is any less of a problem, has any less human dignity, someone who's 70 or 80 or 90 than someone who's 20, is such an anti-Jewish, anti-religious thing that is just, unfathomable. And, and in a segue to your point, I think many often talk about the debate between science and religion, science and faith. And I think Judaism, Jewish thought largely, and we just lost Rabbi Jonathan Sachs this last week. He wrote a great book on this, that Jewish thought does not have to be seen as at odds with science, right? This idea of faith versus science, as if they're opposites, is something that I think is foreign to most of Jewish thought. That science is a tool that is helpful to understand the world. We have a whole series of learning coming up this coming year of science and religion, and it's not framed as a debate as opposites, but how they inform each other, how these tools enhance the fullness of our human experience. In fact, the notion of revelation isn't only from Sinai, right? That Har Sinai, revelation emerges daily. In fact, to the extent that the gematria for the name of God, for Elohim, is the same as Teva. The numerology of the word for nature is the same numerical value as the name of God, which in a Spinoza sense means nature is God. But you don't have to go that way. You can merely say nature is a revelation of divinity in the world, right? Okay, but now to your specific point here, I think that I would say two things. For those who really need to be in community, which I understand with rising mental illness, mental health challenges, and people who deeply rely on communal existence, who pray in minyan multiple times a day, or can't imagine not having a bar bat mitzvah or bris in public, whatever the case is. The first thing is, thankfully, there are ways to do this according to protocol. Dr. Fauci has spoken to the Orthodox Union and others like him, and Dr. Shah, who have shared there are ways to be in public spaces, indoors, outdoors, with masks, with distancing, with limited numbers, where things can be possible. That's the first thing for those who need it. The second thing I would say is, what a rare opportunity to step back from how we normally do things and experience spirituality, experience religious life in a fundamentally different way than we ever have before. I spent this first Rosh Hashanah and Yom Kippur of my life not going into a synagogue, and it was remarkable. I can't wait to go back, But it was remarkable to have an alternative experience, to think about how to do such things. And so I think that the Jewish law is clear that the value of being in a minyan or being in community or being at a Shabbat table in no way overrides the value of life. And on a psychological level, I think it's a chance for us to grow and experience alternative forms of religious life.
Thank you so much, Rabbi Shmuly. This question is for Dr. Shah. What is your estimate on the potential threat of our emergency rooms and the personnel getting overloaded soon, like in examples that we have seen in Utah?
Excellent question. So if we're talking about Arizona particularly, I will tell you that I'm less concerned than I was in the summer. In the summer, we had gotten up to about 91% ICU capacity before things started to make their way down. I thought that was a really scary and tenuous point. I mean, again, and 100%, you'd think we have a little 9% to go. It doesn't really work that way, right? There's a little fuzziness in there because, you know, beds have to be cleaned and all that kind of stuff. So there's some logistics involved. So you're at about 91%, you're really reaching full capacity. And this is after we already expanded capacity. This time around, assuming that we continue with our practices of keeping especially seniors very safe. I am not anticipating actually seeing the resources dwindle to the point where we would be in an emergency, like a point where we would have to ration care, deny care. I really do not think that's going to happen. In the emergency departments during the summer wave, we were certainly busy. We saw a lot of COVID, but the emergency departments themselves were not overwhelmed the way the ICUs were overwhelmed. And I want you guys to keep that in mind. I heard this a couple times from people saying that I'm worried that if I go to the ER, they won't see me. I'll be in a waiting room. I'll be in the waiting room for too long. Now, it did happen in New York. That's a whole nother, in the tri-state area up there, that did happen. Here in Arizona, we did not have so many of those problems. And I think given everything we've even learned from that point and the fact that I think any second wave that comes, and I can't guarantee this, but I think probably would not be as big as the first wave comes. So it is, I'm telling you, it's less of a concern for me. I can't guarantee that remains to be seen, but a lot of the our experience has taught us that's what's going to happen.
Thank you.
And by the way, so as far as resources are concerned, ICU beds were the resource that was most closely followed in Arizona. It wasn't, the ventilators, we actually had them. The PPE, yeah, it was a little spotty at first, but eventually we did kind of smooth that out a little bit. It was the ICU bed capacity. And a lot of that also, believe it or not, that key resource that follows very closely. It's not just the physical bed space, but a bed is not a bed until it's a staffed bed. And so you need an ICU nurse, you need an intensivist, and you need other people like respiratory techs in order to serve that patient. And those are things that the healthcare folks here, the hospital systems, did a pretty good job of getting us to a very high peak and getting us down off it without ever having to really ration care. And I got to tell you, that was a really big victory in the summer.
Thank you, Dr. Amish. The next question is going to be for Rabbi Shmuly. Rabbi, what do you tell people who say, I'll leave it up to faith? If I get infected, I get infected. It is what it is. What do you tell those folks?
It reminds me of that old joke we've all heard a bunch of times of the guy who's drowning and the lifeboat comes and he says, go away, God will save me. And the lifeboat comes again. No, God will save me. And the third time, no, go away, God will save me. And then he drowns and he goes to heaven and says, God, why didn't you save me? And God says, I sent you 3 lifeboats, So it's like, how does God act in the world? And what is it that we use as divine help? And here I would say, there are different valid theologies and Jewishly authentic theologies. And one most certainly is that everything God controls. And that's not, and that there is basically no free will. And that's not my personal theology, but that does emerge very fervently in Jewish thought, that in fact, faith is most central. And we just rely on God for what is good. But I'm much more convinced by the strand of Jewish thought, which either thinks that God has completely removed God's control over the world in a process of tzimtzum, and that this world is a part of human responsibility, or that there is in Musar a balance between hishtadlu and bitachon, between human striving and effort and letting go and trusting, right? There's things we control and we work really hard, and there's things we don't control and we learn how to let go of control. To me, the faith has to do with all that which we cannot control, right? The realm where we don't just have faith that will all be good, but we have faith that we can continue to walk on the path of integrity with what we can control and know that that's all we can do. And so those who, what is clearly not a Jewish position, I know it's a lot to say it's not a Jewish position. I mean, it is not a part of the dominant thrust of any Jewish, intellectual history, is the idea that you go against the core of Jewish values and laws and principles in order to, because some notion of faith outweighs it. Right? I'm going to murder because I have faith in God. I'm going to steal because I have faith. But we don't do something we know to be wrong out of some abstract notion of faith. It doesn't make any sense. And so I think that really applies here too, that we have to do our part. We have to do our part. It's a divine human partnership.
Thank you so much, Rabbi. We have another question. This one's going to be for Dr. Amish. It says, here it is. Doctor, the distribution process of vaccine, heard this morning some concerns from CNN, I think, about using the traditional distribution process, not reaching some non-majority groups. Your comments, please include what can be done to reach those groups. I'm assuming he's talking about, this is from Jose, he's talking about how do we get vaccines and access to predominantly minority and underrepresented communities?
Yeah, that's a wonderful question. So I'm going to break it down into two things. One is that there is, if you're talking about like more of the physical distribution of it, some of it has to do with making sure that people get to the places where this thing is distributed. So sometimes it could be distributed at CVS or a Walgreens, and everybody comes in for their shots as necessary. The other big way in which we've traditionally done these things is through your primary medical doctor. And what happens is that what happens if you don't have one? What happens if you don't have insurance? What happens if you have it but haven't really established those ties? As we know, it's very often in the United States, it's tied to your employment. That those are real serious concerns, and that's where good public policy steps in to say, hey, wait a minute, who are we missing, and why, and what can we do to address those things? I think one of the things that we do have within many of these communities, people such as promotoras. I've met people who, in specifically the Latino community, do that, and it's they're there because they're trusted, which brings me to my second point, which is that some of the sentiment you hear is also one of mistrust in institutions, which is another thing that we have to be able to bridge. People have to feel as though we're bringing something of value to them and not actually bringing something of harm. And that happens through having people that actually live and work in those communities make sure to get that message out within those communities. I'd like to think that within the party that I'm in and the group, those of us down at the Capitol, we really try to get into those communities. We make our presence felt so that people don't say, hey, that's just, who is that? That's a stranger. We try to be people that everyone's like, oh yeah, we know that person. And that's what starts from the top all the way down. It brings up an interesting point because I'm in this vaccine trial, right? So I signed up about 2 months ago, and this is the Pfizer trial that I'm in. And as the trial was kind of wrapping up, they had said, well, I certainly know a lot of people. Are you still recruiting, and do you need more people? And they said, yes, absolutely. Of course, they have to meet some of the inclusion criteria, which is that you have to be out and about and actually interacting with other people, because they don't want people who are just hanging out at home. That doesn't serve the trial very well. So if anybody in healthcare, or you're a grocery store worker, or even real estate agents, teachers, things like that, people who have contact as part of their employment, they're looking for those kinds of people. But they did say, as far as demographics were concerned, that Latinos, Black people, Indigenous people, and Asian Americans were underrepresented in the vaccine study process. So that then you have to start asking, I mean, it brings up this very point. Why? Why is that? Some of it has to do with a level of trust. I know that that's the case. And so on that point, I asked them, well, who is overrepresented? They actually said physicians were overrepresented in the trial. So those of us who are physicians, who are comfortable with understanding science data and all this, we were all like, yeah, me, I want to be in. And so that's you can see that, you can understand that, why that is. So part of what I did was went to my colleagues in the House of Representatives who are members of those demographic groups, and I said, hey, I think it's really important that you guys think about, well, it's a personal choice, okay? It's an experimental product. It's not for everybody. I'm glad it's proven to be safe at this point, but think about being the one to step forward and serve humanity in this way. Because if you do it, then it'll mean that people will follow you and follow your example in those very communities that you serve. And it's important that we know whether these vaccines work in those populations, right? We think they would, because race isn't an important factor in terms of biology this way. Really, that's our medical teaching and training. But again, you don't always know for sure, and you want to make sure that a broad section of society is represented in the study. That's important. And we all know about the history of Tuskegee. If those of you don't know, there's some really horrible things in United States history that happen in the name of research to minority populations. I mean, in fact, you can't get through medical school without knowing what those things are. So right now, they are actually still enrolling for 2 trials at the Hope Research Institute, where I did the Pfizer, where I'm in that Pfizer trial. So the Pfizer and the Moderna trial are both done with enrollment, but the AstraZeneca trial, and then there's one more, and I can't remember the name of it. Those 2 are actually still going to be ongoing. And once again, I'm going to put the call out there and say, hey, the people of those demographic groups, please, we'd love to see you get into that, because then you can look, it's if you're comfortable, and if this is something you can choose to do as a volunteer, then it really does help the idea and spread the idea of comfortability with institutions such as, yes, I know it's a big pharma company, but what I mean is scientists and the scientific process in general, is that we're comfortable with it, and we know that we're doing this to move humanity forward. Because I certainly am comfortable with all the brilliant efforts that scientists across the world have made in this way. So I hope that kind of answers that question.
Thank you. We're going to go right above, because you're getting quite a few questions here, Dr. Amish. The next question is it safe to go for general medical checkups, or would you hold off until there is a vaccine? So, mammograms, physical, dermatologists, etc.
Yeah. So that's a great question. There's nothing that's quite so risk-free as staying in your house and never going out. We know anything you do other than that incurs some amount of risk. And I think we have to be kind of honest about that. That's different from going to a very crowded bar with a bunch of younger people in July of this past year. Those are 2 totally different risk scenarios. And somewhere in there are some things that I think we can do to make ourselves as safe as possible. So I tell people, look, indoors is worse than outdoors, okay? Second, if you're gonna go, then go to places where you know that the proper protocols are being followed. So most of the time, and I can't speak for every doctor's office, but you go into a doctor's office, they are wearing PPE, they are making sure to take care of their own staff and employees to make sure that they're not, infectious. And those people would be asked, hey, take a couple of weeks off and come back. And then you yourself contributing to that, as we talked about earlier, using a mask and just being careful, staying 6 feet apart from people. But when it comes to specifically this question and asking about medical care, then there is a real benefit to your health from going to the appointment. So that's, you have to wait. I mean, you have to make that decision for yourself. Weighing that risk versus the risk of not going to your healthcare provider and possibly missing something that's really important for you. And then the vaccine's coming. So if you're really that concerned, and especially with your risk profile, are you older? Do you have medical problems such as diabetes, hypertension? Obesity has been shown to be a risk factor, and cardiovascular disease in general. So if those are the kinds of things you have, perhaps you're a little more worried, then it would mean either taking more precautions or perhaps delaying it. And that's a long answer without a whole lot of specifics for the person. So I would say do everything you can and be careful. The risk is not zero of picking it up, but there's probably ways of doing that and doing it in a safe way where you can get the benefit of your health while taking only a minimal risk.
Thank you so much. This question is for Rabbi Shmuly. Rabbi, what message of hope do you give to people when they're like, what, I don't see this ever ending. When is this going to end? I want to see my family. I want to see my kids. I want to be around my friends. They're overwhelmed with anxiety. They feel like this isn't going away. What do you tell people? How do you provide some sort of consult? And maybe we can help replicate that as well by providing some sort of support to our own friends.
Yeah, awesome. Thank you. Wow. I mean, I could talk about that for hours. But I'll just say two quick things. One is that one of my favorite midrashim, one of my favorite rabbinic sources, is that Miriam, while they were mamish, still slaves in Mitzrayim, they were still slaves in Egypt, she packs her instruments. They say, time to go. Her instruments are already packed. Instruments, what do you need that for? They didn't even have time to bake challahs. They had matzahs. And she packs her instruments because she said, I know we're going to get to the other side, and I'm not even going to get there. We're going to get to liberation joyfully. We're going to get to liberation joyfully. We're going to have our instruments ready, even in the moment of terror and of trauma, that we're going to be ready because our eyes are on the prize. And so that we can get through scary things joyfully. I know that's a lot easier said than done. And part of that is thinking about in our own lives, how do we pack our instruments? How do we pack our instruments to be on the other side of the stormy waters? And the truth is, this last moment of this last week of experiencing threats on democracy, and then in some ways feeling on the other side of some threats to get to democracy, can reinstill that sense of that there's light at the end of tunnels, that there is hope at the end of despair. So that's the first thing I want to say. The second thing is, I do think that hope is not some kind of abstract thought experiment, but something that we can on a daily basis cultivate through truly having joyful experiences that give us a taste of what it would be more immersed in such experiences. And so I would encourage us to really engage in self-care, to engage in things every day where we're spiritually taking care of ourselves, physically taking care of ourselves, things that bring us joy, that fill us up. Because that feeling, whether it's for 30 seconds, it's for a minute, it's for an hour, that feeling of hope, of joy, of meaning, of learning, of connectedness, even on a small level, that feeling can, I think, help us to persevere towards a time period where we can be more immersed in such emotional states.
Thank you, Rabbi. That was so helpful. This question is from Barbara Lukowitz for Dr. Amish. She said, should we be concerned for our disabled friends and our neighbors because they are additionally vulnerable to COVID?
Great question. I will say it will depend on the disability. Disabilities come in a lot of different types, and it will really depend. We know that people with chronic medical problems do tend to fare worse. There are also logistical issues that make that harder for people to get the care they need, even if, had the same risk profile, they would get the care that they need and be able to follow up and just have the outcomes that people that are not disabled would. It's not as easy to just pick up and go to the doctor's office. It's not as easy to just go get that COVID test and keep yourself protected in the same way. So, and then there are, I because we have a very, very good friend in common who teaches me a lot about the disability community and the challenges. We know that there are also other things that actually increase exposure, such as, people having to come to your house, et cetera. So the answer really is in what are the actual factors. Like I said, the risk factors are the ones we just mentioned on the prior question. There may be some people with disabilities that don't necessarily have a higher risk, but I do think that there's a significant proportion that would, and that's it kind of is done on an individual case-by-case basis.
Thank you so much. Another question: have you been seeing any alarming aftermaths or things that are coming out of people having COVID-19, like things showing up afterwards?
Are you talking about like longer term complications, like long haul, or what are known as the long haulers?
Correct.
Yeah, it's not a good virus. It's a terrible disease. We don't understand exactly how it seems to do this, but it can attack almost any organ in the body. So we've seen people with complications in the central nervous system, in the gut, in their skin and soft tissues. Besides just the lungs, which are of course the primary organ targeted, besides just the lungs, we're seeing this just about everywhere. There's a thought that it might have something to do with the vascular system. So your arteries, veins, but more importantly, those little tiny capillaries all over the place seem to get clogged up, and we seem to be getting these little tiny little blood clots all over, causing tissue damage just about everywhere. So it's caused complications, to your question, in all kinds and shapes and sizes that we never would have expected from a coronavirus, from we've seen prior coronaviruses before, but what we haven't seen is these people that are left with mostly respiratory issues afterward, where there's a chronic cough, there's scarring in the lungs, and all the attendant problems with that, having to take inhalers now, and just not having the same athletic reserve capacity, right? So, you used to be able to run a mile, and now you can only run a half, or whatever the heck it is. So some of that. So it's taken a real toll. Fortunately, it seems that most people, their bodies do eventually get past these things. If they do survive the virus, they are getting past these things. But yes, it's a real thing. Now, the rates, I don't have a great scientific source for you. A lot of time, it takes us time to study these things and figure out, like, where is it attacking and what, but the literature is replete with the numbers and types of cases that we've seen where this virus is doing just about everything.
Thank you. And now I have a question that you may find humor into it, but what do you react when people tell you, or where people completely share, well, this is just the flu. It's only the flu. What do you tell those folks? How do you even begin to deconstruct that rhetoric that this is just the flu and it's as common as it?
No, it's not. It's not the flu. It never was the flu. I could talk to you for a little bit about this, but I'll leave it at this. First of all, the flu, as it comes around every single year, certainly does kill people. There's a certain number of people that die every year from the flu, but never have we had a flu where we've had to, like if you look at the images from Italy and New York City and even from China, we've had a flu where all of a sudden we were just filling up hospital beds everywhere and had to, call in the cavalry and just suddenly people getting so ill so fast. That is not the way the flu goes. The flu also tends to hurt people who already have chronic medical problems, extremes of age, things of that nature. But one of the things, if you work in healthcare, you get this right away, is that COVID-19 is the proximate cause of death and disability and harm to people, whereas the flu, it is there, but it does hurt people with those conditions. But in many cases, the flu is hurting a lot of people that were suffering from a lot of chronic medical problems anyway. Whereas this disease seems to be taking people who ordinarily would have just shrugged off a flu and really bringing them pretty close to death. And that's something that every healthcare person understands and knows. And I think that sentiment comes from people who just don't seem to have the exposure to knowing somebody who has it, who've gotten really sick, and seems to see, base their opinions on media reports or whatever media they happen to be listening to. So I think that just having some firsthand look at how devastating it is for people, watching people. I mean, I've certainly seen my share of very sick people with this, hearing about people who have died, who are friends, family members, that changes people's mind pretty quickly. And I think that sentiment, I actually, it was at the beginning of all this, it was more prevalent. I think we're seeing a lot less of it now because it just affects so many people that everybody knows somebody who's had it or died or gotten really sick. So I think that we're seeing a lot less of that today. I could get into the specifics, which is that this is one of the things I really try as a physician to make people understand. This disease has an infection fatality rate of about 0.5%. Okay. Does that sound so bad individually? No, it actually does. That means your rate, just all comers, 99.5% of people will survive this disease if you get it. That sounds like, that's not so bad. I guess my chances of survival are 99.5%. Now, take that across an entire society. How many people are going to die if 0.5% of people die? You're talking about a massive number of people that are dead from this. And that's what I try to tell people when they come into the medical setting and they give me some of these sentiments. And I said, it sounds like a very low number, but now think about how many people are dead from this and ask yourself if that's okay. So where does it fall with regard to, say, other things like car crashes? Okay. Trust me, it's nowhere near 0.5%. It's like orders of magnitude away. So the chances of dying in a car crash are 100 times less than that or less. And so bringing some of that, in a humble way and by listening to people, I've been able to tell them about why this sentiment is just simply false.
Yes, thank you so much. I appreciate your answers being so thorough and helpful, because I know like a lot of conspiracy theories are thrown out there, right? And this works to push forth an inaccurate rhetoric that tends to leave people to think that they can do what they want, and that we kind of forget that this pandemic, we're still in a pandemic, that it's over. And I think it's very crucial, especially for folks, to acknowledge that and think that it isn't just about you. It's about the potential that you have to hurt somebody else, the potential that you have to get somebody really sick. And that's largely something that I think that in our American society is something we have to move away from. Move away from the I ideology, right? That if it doesn't personally affect me, then I'm fine. Moving towards the fact that saying, you know what, this is affecting my society, and I can personally get somebody sick or killed. That's why I think it was such important, the message of hope that Rabbi Shmuly was giving us, and to focus on letting other people know that we're going to be okay, but you need to pitch into this, right? Like you need to do your part, which is so important, that we make sure that we wear a mask when we're out publicly, that we are making sure that we are sanitizing everything that we touch. And I don't know about y'all, but I have been increasingly paranoid about how many times I actually touch my face, just to make sure that I'm not actively touching my face. Personally, my mother almost died because of COVID. And she was a person that thought this wasn't real. She thought that this wasn't gonna really impact us. And then she got it and almost died. So this is very real and it's very close to us. And like you said, Dr. Amish, we all know somebody who's had it. And unfortunately, we're getting closer and closer to the numbers where we all know somebody who might have passed away or been close to it. And in Judaism, our Jewish spirit and our Jewish values really push us to be advocates for our community, to stand up against anything that tries to dismantle or oppress more people. And we've seen that right now, historically, Black and brown communities are really feeling this pandemic. So it's our job to make sure that we are actively trying to support, which is why I love that we have our mask project, where we have been handing out more than 2,000 masks to our unsheltered community. And we're going to continue to send more masks out. If you want to find out more about that, look us up on urielitzetic.org /mask project. You'll find more information and how to get involved there. I want to give a huge thank you to our great friend, Dr. Amish Shah, and my great friend and mentor, Shmuly, Rabbi Shmuly Yanklowitz, for really grounding us in hope, and Dr. Amish for giving us a real look on the fact that we're still in a pandemic. And it takes all our parts. It takes each and every one of us to keep our community safe. I thank you so much. Yes, Dr. Amish, you have closing?
I want to, yeah, I guess I just want to add just one thing. We just went through an election, and you can see it was contentious. And I want to add something that those of us who do this, get into the public sphere, do it because we love the country. And to me, the country is not the land between the Atlantic and Pacific Oceans. The country is the people that inhabit this place. And if you are really patriotic, you are out there caring for American people and their lives. That to me is what it's all about. You're there to serve, and you're there to take care of those people's lives. And there's nothing more patriotic than we can do than to do the things that we just talked about here to keep ourselves and other people safe. The mentality that, I've got mine and that's good enough, or maybe for me and my family, and that's good enough, is not, to me, a patriotic sentiment. And if we're really serious about loving the United States of America and being patriotic, then we can do our little part to take care of one another and be kind, be respectful, and be good. And I'll say that overwhelmingly, the people of Arizona that I have seen are on board with that.
Perfect. Thank you so much. I hope everybody has an amazing day. Quick reminder: take time to breathe. Take time for yourself. Like Rabbi Shmuly said, self-care is crucial right now. Self-care is so crucial. Reminder that a little bit of light dispels a lot of darkness. A lot of darkness. You have to make sure that light stays lit. Everybody have an amazing day. We look forward to learning with you soon. Take care, everybody.
Thank you. Thank you, everyone.